Here we go. Hello and welcome to our Friday webinar. We are on with Dr. Tom Tully for a episode of Ask the Vet. And hi, welcome, Dr. Tully.
Well, how you doing, Laura? And it's good to be here. It's good to have the attendees and looking forward to the questions and learning a little bit and discussing. Looking forward to the Association of Avian Veterinarians conference next week.
Oh, wow.
Learn a lot, see a lot of colleagues and discuss cases and help you know treat the birds in the future. So that's the future of avian medicine and a lot of young veterinarians, students, and so always exciting and have enjoyed. That's such a great organization. And so you just had AFA, correct? With about a month ago or so.
AFA, Lisa Bono was our roving reporter for that. Yeah, it
Ah,
was, yeah, a couple weeks ago. So she
fantastic.
gave us the lowdown um, and in her last webinar with us. So speaking
Yeah,
of exciting, we were we Dr. Tully just like jumped in the seat at noon when the webinar time because you came straight from surgery, right? That's exciting.
right, right. Yes, definitely. Just right from surgery.
Wow. Okay. That's
So
amazing.
yeah, I'm glad everything went well. Took time, was not, and we had a great team, and it was a hernia repair and a little cockatiel, and cockatiel's up, ready to go, and so everything went well. So happy about that.
Okay,
Always,
that's amazing. It's
always,
amazing that you can do a hernia surgery in a little cockatiel. I'm just like,
yeah.
I just find that, wow. Okay. Well, we'll wish the little teal a speedy recovery. So once you get like,
Yes.
yeah.
So
Um,
it's great, and we have a great day. Fall starting a little bit cooler here, so always happy about that. And so it's good.
it's
And
cloudy here in California. Which
uh,
reminds me, if you're just joining us, tell us where you're coming from. 'Cause we like to know where everyone logs in. And if you have a question for Dr. Tolley, use the Q&A button, not chat, Q&A, and then we can get the question addressed. Let's see if we have any Stump the Vets today questions, or if we have a theme. Because some of these times we just have the organic kind of theme that kind of erupts. So it's kind of cool to see that too. Just like some of the questions kind of like are nice segues into the next one. So or all over the place. I like that too. So
yeah, yep. Uh, sometimes you're right. It does go, and you have it seems like the questions are all related, and then and that happens more than you would think. So that's good.
all right. Okay, so question for you is a 6 inch by 2 inch wet area around poop for a 2-year-old double yellow-headed Amazon normal. So it's kind of like a urine area, like a 6 inch by 2 inch kind of wet drop zone. Is that normal?
Um, again, Laura was starting off with a good question. Talking about um, urine and feces, and so the when of course the digestive system and the urinary system are connected in birds, and they're both voided through the vent. And if you can actually have primarily urine or very little urine and mainly fecal material out of the vent. So you can, it's just, it varies. If we have a bird that comes in that's a little bit stressed, a little bit excited, something is in handling, and just it's nervous. It may have primarily urine. It's just going to urinate, and you're not going to have much fecal material or the white urates kind of sediment in the fecal material. So that's kind of the basis. And I think everybody, and most everybody on the webinar understands that. But the good question here is it normal to have this large, this, I'm not going to say large, but I mean, it's a 2-inch by 3-inch or 3-inch by 6-inch.
6-inch by 2-inch. Sorry.
Huh?
6 inches by 2 inches.
Yeah, 6 by 2. Yeah, of urine, and so or kind of urine component. And so when the one thing that I want to stress is that that's one of the things. Anytime anybody gets any birds or has a bird or brings in a bird, or we're looking at a visit, is we try to go over different aspects of bird care and what to watch for. And if you don't know what to watch for, it's very difficult to tell if you're or to evaluate the bird's condition. It's very difficult to determine if when that bird is not doing well. And I think everybody who has birds and interacts with birds and it kind of keeps close attention will say, yes, I know when that bird isn't feeling well. I know when that bird is not not happy. I know when it is. And so we look at providing criteria to evaluate a general bird's condition. Looking at the fecal material and the urine is one of those criteria. And so it's good that you're asking this question, because that's what everybody should know. The first thing about an abnormal, if you have normal, you have to consider what is going to be involved in making that urine or fecal material abnormal. And that's what's ingested. If somebody calls up and says, oh, my bird's stool is bright red, what, or it's bright green, or it's light blue, the first thing, what did the bird eat? Because what it ate has often a direct correlation to the color of the stool. And that's the same way with the consistency of the stool. And so if it's a high water content, you're going to have more water. If it's a low water content, you're going to have kind of less urine. It's going to be less moist. And so the color and the consistency is going to be directly correlated to what the bird eats and the general bird's condition. So that's why, I say, look at what's normal. Under normal circumstances, under what the bird normally eats, and you need to know what the stool and the urine is normally. So if you see something that doesn't look normal, try to figure that out. Is it an illness? Is it a GI problem? Is it because, I had some friends though, we had a party, and the next thing you know, they were feeding them pigs in a blanket, or they were feeding them gummy bears or something like that. I don't know, something that somehow that affected the digestive system. And by all means, don't feed your birds those or any of that. But I mean, it's just one of those things. So when you're looking at a 6 by 2 inch, large, you have to look at, one, on paper, how much are you getting to where it is wicking, and you get it's an amount, but it'll spread out on that paper. Okay, so you get, and so it kind of disperses and as it's absorbed by that paper. So kind of think about that. Also, what's normal, and so that very well could be, but in when you keep this in mind, and if the other aspect of it is that, did this just start? And you're saying, well, no, this isn't normal. This just kind of started. There's nothing with the diet. The diet's the same. If you
Mhm.
notice a significant change in the urine or the stool, or a combination of both, with no change in diet or what have you, then it is something to say, well, hey, let me go get this checked out. Because the other thing you need to know is that drinking more water, we call it I don't know why they call it polyuria, polydipsia, PUPD, because polyuria, of course, is a lot of urine. Polydipsia is a lot of drinking. And I think you need to drink before you urinate. So I would think it would be called polydipsia, polyuria, but they don't
Hmm.
call it that. So I don't know. But nonetheless, if it drinks more water, and then it would have a tendency to have a lot more urine, right? And then in that case, if there are things that are disease conditions that could relate to that, and diabetes is one, diabetes mellitus is one, it'd be a diabetic, or it has a high blood glucose, blood sugar level, and then that's one of the things. And I'm not saying that's the case now, but I think a simple question when you say, is this normal for my parrot to have a 2x6 uh, fluid or urine in its stool? Is that normal? It's just not. We need to talk about all what I have, is to
Hmm.
know what normal is, and to realize that that intake and whatever you eat is going to affect the color consistency, and that you should know what normal is, so if you see abnormal, that you have the bird checked, or before you say, well, why could it be abnormal? If you can't figure that out, then it may be time to get the bird checked. So what you're
Okay.
saying may be normal, it may not be, but consider everything that I said to evaluate that, and then you'll know if it's normal or not. Thank you.
Defining normal. Okay. All
Yeah,
right. So we have a question.
exactly. And
We have a
each
question.
different.
Question about a budgie of unknown age that frequently breathes with her beak open, almost appears to be in distress. So they've taken her to the avian vet and an avian veterinarian ER several times since they got her in February because of this, but no cause has been diagnosed. She's had X-rays to check for respiratory and heart problems and blood work done. All have come back normal, and she continues to do it. And she doesn't have any trouble flying or eating. Do you know what it could be, if anything?
So is it a breathing problem?
Looks like a breeze with her beak open, kind of like, like yeah. You
Mhm.
did a better job imitating it, probably. Yeah.
I've seen that, and you have too, I know. Um, the the bird breathes with his beak open, and
Appears to be in distress, so.
appears to be in distress. Yeah. Um, yeah. Uh, that's good. Now that's what it appears to be, and so that's why you bring him and get him evaluated. One of the You say, well, what could cause the bird to be in distress? Um, well, one is the location of the cage and environment. You look at in the environment and see if that is conducive to the bird being comfortable within its surroundings and not of concern, or there's something in the surroundings that may cause an issue. So then if you say, oh, it's the most perfect environment for a budgie, they're in heaven, budgie heaven here. And so there's nothing wrong there. And I'm assuming that this is one budgie in a single cage and not with multiple budgies. And so if that's the case, then you can rule out other birds in the cage or the enclosure bullying the little budgie. I have if I put a third budgie in my budgie enclosure, the other two would run them out on a rail. They're not going to have anything. This is ours. We're not, two's company, three's a crowd. So that is always a possibility. And then you get into the respiratory condition. You think say all stressed out. It appears that you had a very good and thorough workup on the little budgie, and there was nothing. Everything was normal or negative. I don't know the age or the sex of the budgie. Sometimes, and this appears to be going on for how long, Laura?
Since February. So I think there are two budgies that are rescue budgies. They've had them since February.
Yeah. So the one thing that you may want to look at is possibly separating the budgies if everything is fine, and seeing if the budgie in the if it doesn't reduce the anxiety or stress that you're seeing on this little budgie that is apparent in, say, kind of a respiratory distress condition. So that would be one thing to do. If it seems like you've had a very good kind of workup and evaluation of the case, and there's nothing it appears medically wrong, then, like I said, it's environment. Always look at environment and see what's conducive, and that's things around the cage and enclosure, and that's within the enclosure, because conspecifics or other birds in the enclosure can be very overbearing and cause stress. So yeah. All right.
Okay, let's see. We go back to this. Sorry, I'm on a.
Oh no, that's all right.
Okay. Okay. What is the best treatment for the to treat discomfort of arthritis in an 8-year-old budgie? Would it be tramadol, gabapentin, or meloxicam, etc.? Got an arthritic 8-year-old budgie.
That's good. So what you're looking at are you have older birds, just like all animals that get old, they get arthritis, and that includes like people like me. I'm trying to reduce that and trying to kind of delay the inevitable, but people have arthritis too, and that happens in birds. And that's the good question is sometimes it happens a little bit sooner than others, but recognize this little budgie may have arthritis, and so what's the best medication? The one thing about medication is that I try to I don't like medication if you don't need it. All medication has side effects, and I always used to say, and when they had the physician's desk reference with all of the medications in it, and when they printed it, it was like a foot thick. almost literally. But and I would say like 3/4 of that was side effects. And if you listen to, most of the medications you have side effects. There's more side effects than what actually is beneficial. And so you say, well, why would you take any medication if you have more chances of failure than you do of success? Well, that's not necessarily the case, but you do have significant side effects with medication. And so it's one of those, well, we have arthritis. The bird's not getting around. It doesn't feel well. I need to give it something to reduce the pain. What can I give it? Well, I would say that most of the time I would like when I'm talking about prescribing for chronic illnesses like arthritis is to give them the medication as needed. Like if they're, not to like say, well, you're on it for the rest of your life, to give it. And if the bird, is good and it improves, that then you take it off of the medication. And then you may not have to treat it for a month or two or longer, or you may have to be started sooner, but then at least the bird's off the medication for a period of time. You see? And so then you have, you mentioned specific drugs. You have tramadol. Tramadol is an opioid drug, and what you're looking at there is that by all indications, the oral uptake of tramadol isn't effective. We've done some PK studies on the metabolite to see if we could get therapeutic doses of the tramadol metabolite in parrots, and it does in even in small animal medicine, it is not it doesn't appear to be very effective, and it's an opioid, and so the effect on arthritic pain would, even if it was effective, would be somewhat questionable in your budget. Gabapentin, on the other hand, that was approved for diabetic neuralgia for diabetic cases in humans for neuropathies that the diabetic people have, and this is something that it's kind of the drug du jour. If you have a nerve pain or nerve problem or what have you, gabapentin, give them gabapentin. And the one thing that I would say is that there's very little evidence-based information on the benefits of gabapentin, especially as it relates to arthritic conditions. It's more focused toward kind of neurologic, I guess, conditions, for the lack of a better word. And so then you get into meloxicam, and meloxicam or Onsior, rabinacoxib. There's some other non-steroidal anti-inflammatory medications that, again, have been used to treat what you're looking at, chronic arthritic conditions. And with the chronic arthritic conditions, I would say that we have seen some positive, just myself, I'm thinking of some of our raptor resident birds that are older that we know have arthritis through diagnostic testing and radiographic imaging, x-rays. They seem to benefit from the meloxicam or non-steroidal anti-inflammatory. So it's an excellent question, because you have, you named 3 kind of groups of and examples of groups of drugs that are used for neurologic and kind of pain and have been used for neurologic and pain in animals and in people also. And what's the best for say chronic arthritic conditions like you're describing in your budgie? I would say something like meloxicam or the non-steroidal anti-inflammatory, and not the others for the reasons that I stated. And so, yeah, good question.
All right. Okay, so we have a cockatiel question. This is a small bird theme today, kind of.
Well, yeah, I mean,
Yeah,
we get on
love
the
it.
budgie or the cockatiel, and I'm fine with that. And then sometimes we're on others. Yeah, yeah.
Okay, here we go. So we got a cockatiel that's one of their cockatiels, approximately 7, 8 years old, was just diagnosed with yellow parentheses Latino cockatiel syndrome. So the goal was to maintain a good quality of life. They're wondering what the prognosis will be, how it will slow down. They also want to know about the importance of removing foods with carotene in the diet. So he's not in a seed diet, although there are some seeds in the foods. He gets Harrison's adult lifetime fine and Lafeber Nutriberries since they got him 4 years ago. So he's a rescue bird they adopted, and his actual age is not confirmed. Is this syndrome in the genes, or can it be spread to other cockatiels? So what can you tell us about yellow cockatiel syndrome, which is, I don't know if I've ever really heard that myself. So I'm curious to know what this is.
Yeah. Yeah, well, I'm gonna have to look it up. Stump the vet today. Yeah, yellow cockatiel syndrome. I've not heard about. But like I say, I learn something every day, and I thank you for bringing it up. The only thing that I do know is that when you say syndrome, that means whoever, whatever it is, nobody knows what in the world's going on. It's a yellow cockatiel, but we don't know what's going on. So if it's a syndrome, if it's like, you know, you know, circling backwards syndrome, that means that people who go and walk in circles backwards,
Yeah.
well, it happens, but we don't know why, you see. And so anytime you hear syndrome associated with any kind of disease or condition, I would say is more like it, like some type of a condition, then they're going to put syndrome, conure bleeding syndrome, and so that's that's just what I do know. I don't know. I'm gonna have to. I'm gonna have to write that yellow budgie.
Well, so Brenda points out that it's it could be a term for a genetically inferior cockatiel, like it usually the Latino varieties. So it's, if you familiar, could that be coming into play here?
Well, I mean, you
Genetics.
have color mutations, and you have so is it just, and I've seen, like Latino budgies and Latino cockatiels, and so the thing is that is the yellow budgie with the little white patch on its face.
Mm.
Um, does it have something wrong with it? I mean, do they see this? I mean, there are some, so anyway, I'm gonna, try to get more information on this because I haven't seen any, but I haven't heard of the yellow budgie syndrome. I don't know what's the bird doing. What's the problem?
Oh, okay. Yeah, I'm not sure. Oh, okay. I guess Just get this from, but maybe like some of them have, or since they're kind of inbred, that they can get bald spots and things like that. But yeah, I mean, that'd be an interesting dialogue all on its own is, like a normal gray cockatiel coming in versus like a Latino
Latino,
cockatiel.
and the Latinos would have less feathers on their crest and on their head. Um, but no, I'll find out, and we'll find out more. I mean, I like the speculation, and it's good, but if I don't know, I don't know,
Okay,
and so that's what we learn together.
that's right. This is an
We've learned
interesting,
a
yeah,
lot of things. I'm anxious to learn about the yellow budgie syndrome, and sometimes it gets around and through um, different the avicultural community before we see it, and it's dependent. It may be something on these color mutations that you to determine that. I know that there's some recessive gene conure issues and things like that that are genetic, and birds are no different than any other animal, and it's just like humans have genetic abnormalities that develop into just different disease conditions that birds do too. Yeah,
yep.
the
Okay, so we
yellow
have
budgie syndrome. Yeah,
yellow
I
budgie
like
syndrome.
it. I like it. So
Yellow, I'm sorry, yellow cockatiel syndrome.
yellow cockatiel
Yeah,
syndrome.
yellow cockatiel syndrome.
Oh, okay. Yellow cockatiel syndrome.
Yep.
Well, yellow, thank you. But it may be the Lutino aspect. And so the question about that was what in the
I guess it was just diagnosed with yellow cockatiel syndrome. So they want to maintain a good quality of life and wondering what the prognosis is. So basically, he's been diagnosed, it sounds, and they want to know what the future holds
yeah.
for
Yeah,
him.
and that's a good question, and I know that the person asking the question is concerned, and um, it's not something that uh, unless I know specifically, I'm not going to speculate because I don't want to say, well, it's this, and then come to find out, I was like, Gilda Radler, never mind, never mind. It was
Oh,
not the right thing. I mean, and so I don't take it lightly just to kind of speculate on something like this. So,
yeah.
if it is the Lutino situation that somebody's calling the yellow cockatiel syndrome, um, as far as the Latino is concerned, usually with the ones that have been more recessive as far as the general phenotypic appearance or what the bird looks like outside the cage, the more recessive it is, the less the lifespan is reduced, as opposed to one that has a lot of vigor and is normal. And so, um, but that's but I'm going to have to see what else is involved. But otherwise, in like the Latino cockatiels, I haven't seen anything more or less problematic than, and I had one myself, over the years, that uh, that would make them more susceptible than other uh, that live their life expectancy, which is a little less than, excuse me, a little less than your other color mutations on that. But we have a normal cockatiel soccer Trask is 29 years old. We have a 29-year-old cockatiel that's
Wow.
exercises every night. The owner exercises it and flies it every night. So, yeah, I'll, mention good things, and
Wow.
that's fantastic. Yeah. So
He must get excellent vet care.
well, no, I think we do a little bit, but it's the owners. It's all of the pet, and I'm a pet bird owner, but it's what we do for our birds on a day in and day out basis that whoop,
Yeah.
uh, we try to just advance our knowledge to share so that the pet bird owners can do what it takes to have the birds live long, happy, healthy lives to their life expectancy. And I can tell you, birds are doing that. They are living long lives, and we are continuing to advance our knowledge not and products to provide good nutrition, not only pumpkin spice nutriberries, I might add, but just all around. And so that's
Excellent point. That's an excellent point. Okay. Yeah, we do have a heavy hand on this. So good point there.
uh, who's sponsoring this webinar anyway?
Oh my goodness. Okay, we have a question about any potential interactions, a 950-gram Moluccan hen between gabapentin, 0.1 milliliter ml once a day, and Metacam, meloxicam. That was the question. Thanks. So, is
So
there a interactions between these two medications?
um, no. I mean, you can give obviously, you were prescribed that, I would say, and there's no um, adverse um, that I'm aware of between the two different classifications of drugs. And as I said, one's going to kind of go more as an anti-inflammatory, and one's kind of uh, a drug that is going to, like I said, it was um, kind of diabetic neuropathies was what it was um, actually developed for or approved for by the FDA. And then it's been anything that's nerve related. Boom, gabapentin. And so just anecdotally, we get a lot of this information is like, well, it's working. Well, it's not working. It's working. Then there's not a lot of good evidence-based medicine that it work on what kind of pain it is very helpful on and what it's not. And I don't think anybody really knows. And so that's why it's possible it can work, and neurologic issues are some of the most frustrating conditions that we are presented with, and some difficult and frustrating because they they have a difficult time getting a response. So it's like, well, let's give it gabapentin, and sometimes it is effective, and it's worth a try. And so uh, the side effects I think are very minimal, and like I said, there's people that on cases that nothing else has worked on, gabapentin has. So it's just another option. I don't think it's a miracle drug by any stretch, but you're not going to have um, any kind of conflict in between uh, uh, the meloxicam and gabapentin, not that I'm aware of. Yeah.
Okay. I like
Yeah.
this next
Good
question.
question. Yeah.
Yeah.
I hope it works. I hope it's working for your little your Moluccan there, So
Little Moluccan, really.
yeah, a little Moluccan. Yeah. I'm sure it's got a little voice. Me, me.
Oh my goodness. Okay. So we have a question about a 3-year-old male budgie whose cere has started turning brown. So used to have a nice dark blue until a few months ago. It's 3 years old. Male
Mhm.
budgie, blue cere is turning brown.
Yeah, what you'll read is something like it may be associated with some type of a tumor, or maybe a gonadal tumor or something as it relates to hormonal changes. That's all very, very possible. And it's a what color budgie is it? Regular, normal, green?
Oh, does maybe we can get that. I don't have that. But it's just that the seer used to be blue, a nice dark blue, and now it's turning brown. And it's a
Yeah,
3-year-old male.
yeah. What's that? Just a
It's
male.
3 years old, so
Yeah.
yeah.
And so kind of it's a aging process, and I, uh, I would look and see if there's any abnormal behavior of the little budgie. Sometimes they'll say, well, it's a um, like I said, it's a disease condition. It's a possible indication of a tumor that's affecting hormonal levels or what. And they'll get what we call hyperkeratotic or excess and thickening of the cere, and you can almost see layers of it
Mm,
on the little budgie. And where that blue cere, the pink, is smooth and round. And some of these older budgies, you get this thickened cere and brown. But as far as this being a issue that's of a health concern, I it doesn't necessarily have to be, and it isn't, and not necessarily it is. It
mm.
could be just normal, um, really maturation of the little budgie. And I haven't really, I tell you, I haven't made any connections with cere coloration over time. Has it been where there's a problem? Yes, it has. But in general, I just think it's kind of a normal variation. And it also is nutrition. Make sure that the little budgie is getting a good dietary offerings, and that will help reduce any type of nutritionally related condition that may be associated with the thickening and the just and the darkening of the cere. So those
So,
are some things that could be.
like scaly mites, could that also, is that something that would
You know,
very obvious
one
if you,
thing on the cere, that's a good question. Thank you so much. The one thing about the mites is that usually it's going to be not just the cere affected, it could be, but look at the beak. Look at the beak, because the beak is going to have, if the cere is affected with pneumococcal mites or scaly face mites, the beak is going to have little bitty microscopic holes in it. And you can see it, put a magnifying glass, what have you. And also around the edge of the beak, we call this the commissure of the beak. It's right at where the hinge of the beak is. They'll have excess, and sometimes it'll be thickening of the skin with little holes in it, like little honeycombs. And those are
Mhm.
the tunnels of the little mites. But the beak itself will be really, uh, it'll be dry and flaky, and you'll see little bitty honeycombs in the beak. Now it can extend to the cere for sure, but if the beak, if the cere's affected, the beak surely will be, based on all of the little budgies that I've seen. So that would be something to consider and look closely. But you could get a little magnifying glass if you want, or what have you, and you'll see those holes in the thickening skin where those mites are. And then of course you're going to treat that bird. And if you have another bird, you don't necessarily, you don't have to treat that bird because that bird isn't, doesn't have the disease. But that's what you're looking at. You can, like I said, it could be a variation of normal as the bird's maturing. It could be due to a nutritional kind of deficiency, kind of vitamin A, something like that, that's causing the skin to thicken and a little bit discoloration. So that needs to be checked out. It could be indicative of the onset of some kind of a hormonal change due to a possible tumor. And then the possibility that you're just seeing kind of the I guess it's kind of the most obvious change that's associated with scaly face mite infection. So
Okay.
That's good because this happens. I mean, you could get changes in whether it's blue, pink initially, you can get these changes and we see it. But excellent question. Thank you. Thank you.
Okay. So a
Yeah,
question
good.
about is sleeping more than normal a symptom of illness? Is that a sign of illness if your bird seems to be sleeping more than usual?
Yeah. Yeah. I mean, that's a sign of something's abnormal. Something's, if it's sleeping more than what it, and that's what I always want to emphasize. And you've heard me say, birds are prey species. They don't show their signs. And, I'd say that's a bunch of hooey. I'd say if you know what to look for and you're very attentive to the bird, you'll see these signs. They're subtle, but they're showing signs. And you say, well, this bird is just like, it's not eating as much as it's normal. Oh, the stool looks, it's not in, the urine part, it's like not what it normally is and nothing's changed. It's not as active. It's not vocalizing like it normally does. It's not perching on the perches it normally perches on. These are all indications that, hey, something may be going on here and you may want to get the bird checked before it gets any worse. So, these are like checklists that you should, have either mentally or if you just need to write them down. But that's what we try to go over to educate people who are maybe not really knowledgeable about birds, but wants to have a bird, what to look for. Because this isn't something that, you would, kind of familiar with dogs and cats, but, not birds. And so, you just put a bird in the cage and change the water, change the food, what have you. And, you barely look at it because you're so busy during the time frame or what have you. It's understandable, but it's just to be aware of that. So if a bird is sleeping more, that means that it could be like not feeling well, just like when we don't feel well, we like to I need to lay down. I'm just tired. I just can't. Whoa, you know, that's the way I feel, And so I mean, you just so that's one thing and one consideration on that. But you bring home, again, a good point. And this is kind of like I guess this is kind of the connection today too, Laura, is just kind of having a knowledge of what's normal for your bird. So you can be aware when it's abnormal and kind of assess why it's abnormal and if the bird may need to be seen to be ahead of the game and to be able to give yourself the best chance of having the little bird recover before it gets to be skin and bones and like, oh, now, and then that makes it extremely more difficult for it to recover. Yeah.
Okay. Do you recommend any herbs for arthritis? So their avian vet has one of their older Pionis on a devil's claw, turmeric, and ginger mix.
Hmm. No, I do not. I do not. But nice question, and I do appreciate it. But no recommendations on this. I would just recommend if anybody is is looking at that in birds, and I'm sure that some people are, that they would go to those that have more knowledge of that as it relates to the herb and the what the herbal medication is promoted to do. Yeah,
Okay.
but yeah, but thank
It, I'm thinking of like senior bird nutriberries. It's got like the herbs for
you. Yeah, well,
the
I mean,
kind of.
and again, the senior bird berries, you can look and see what the ingredients are and what they're associated with, and how that is going to be, and how that's promoted to be, again, beneficial. And that's what you need to look at. And again, until you do, you can get the senior bird berries, right?
Right. Yeah. Okay. Do birds normally sleep more and are less vocal when they're molting? So does the molt kind of make them more sleepy and less vocal if they're molting?
Uh, that's a good question, and I believe so. I believe so. I mean, you think about the birds undergoing a a change physiologically in molting. The body is producing and generating new feathers, and so and like I said, a good example of this is the canary. You look at canaries, and when do canaries molt? In general, they molt during the long days of the year, and and what happens when canaries molt? They stop singing. Okay. And so that's, I've had calls. Well, I had this beautiful American singer, Waterschlager, what have you, and we have the and it was doing so well, Doc, and it was just like singing away. It sounded, like concert, singer, and then it's not singing anymore. What happened? What did I do wrong? And usually, the canaries are going to sing when they have all their feathers. It's mating. It's mating season, and so they're trying to impress all of the other canaries out there. And so yeah, if you have a lack of vocalization, a lack of sleeping, that is, or you have increased, where the animal is not active, then that's not routine. That's something to be, hey, what's going on here? Now, it may be like the canary you call up, and and it's June, and or May, and you say the canary isn't singing. Then I said, oh, no problem. That's, just is everything else okay? Eating, getting around. Yeah, well, I just believe it's molting right now, and that when we get back into September, October, November, even maybe before, it'll start singing again. So yeah,
Okay.
yeah.
I just learned a kind of recently learned a new term. It's called eclipse plumage. And I guess we think of ducks, like apparently, and I could be, correct me if I'm wrong, but male ducks after the breeding season, they molt their feather, they molt out their bright color feathers to take more of the coloring of the female.
Huh.
So they have better coverage like from predators because they can't fly efficiently at that point.
Ah,
So
no.
they're not
Uh,
sitting ducks, so to speak. They can so they take on the female's plumage during a certain time of the right after breeding season, apparently.
well, that must be just after breeding season, right before they migrate.
Yes, that's yeah.
And so that's because they lose all their feathers. Yeah,
They,
wow.
they kind of briefly grow them back, like they look more like females, so they blend in more with the
Yeah, because they can't fly
yeah.
because they're getting the new feathers in. For some, parrots, that's not the case. They don't I don't think they ever get into a situation. Of course, there's no eclipse plumage for what? A scarlet macaw.
Can you imagine? Yeah, where's it gonna
I mean, can you imagine, Uh, but no, but yeah, that makes sense because they need to hide, uh,
yeah,
during that time. Yeah.
yeah. Like
I
it's
like it.
yeah,
Yeah.
I just
I,
love learning new things.
yeah.
Like I come here every time with you guys and learn new things. So
Well, I mean, I just like, I mean, I don't recall the eclipse plumage, but I know I know when it would be optimum just before they, right when I can't fly, I want to look like the ground, right?
that's right. I don't want to bring attention to myself when I'm
Yeah,
my
no,
most
I
vulnerable. Is yeah.
mean,
But
yeah, duck,
um,
duck.
speaking of eclipse plumage, I'm gonna do a kind of I'm a segue into the fact that you're gonna be on with us on Halloween, on actual Halloween, the Halloween.
Wow, yeah,
Next
I forgot all about that.
So we'll be covering, I
Yeah,
mean, this
I
will be
mean,
fun. Yeah,
I always look forward to that. I know that that some people, it's like it's a kind of a favorite holiday of mine. Other people, it's like, maybe not, but it's always a reason to have fun. Have fun. The more fun you have, the happier you are, and and that's a good thing.
that's
So
right.
looking forward to that, and yeah,
I was going to ask if, because it is Halloween that we're going to be having our next Ask the Vet, if people, let's see if our viewers, if our attendees today, if anyone's, we're kind of like thinking of creatively here, if anyone wants to dress up in costume on that date, maybe we can find a way of like having us share screens or something, but like anybody interested in joining us in a costume on Halloween,
well,
let's,
I mean, it is a nice fall is always fun. It's especially I don't know. It's so I think that we can I'll come appropriately attired and I don't know what what it'll be but uh but anyway we'll have a good time.
That's right. Yeah, it'd be great if anyone in the chat wants to say if they're interested in should be in a costume on camera. I'll log in a little bit earlier and we can kind of yeah. I mean, it's a
Exactly.
fun day, right?
Yeah, yeah. Well, we'll come up with something, I guess.
All right.
Talk with Brenda, and between you and Brenda and Laura, y'all come, something will come up.
My favorite is I think last year you were I can't remember. It wasn't exactly on Halloween, but you had your mask on. And so I was just like, this is the best. So when people watch this episode of Ask the Vet, if they don't realize it's a tie-in to
I
October.
know, I know. I kind of like that. I may have a mask. I have my mask up there.
Oh, we'll save it. We got a month. We
But
got
my
just
little crown of
people.
but yeah, sometimes I like to do different things, just keep just make it fun. So I don't know what it's going to be this year.
You got time to you got a few weeks here or a month to figure
Yeah,
that
I always have a default. The mask is pretty cool. But I'm gonna keep my eyes open.
out. All right, a big reveal on October 31st. All
Yeah.
right, so what we got, let's see, I gotta do our announcement for today's giveaway winner of, guess what we're gonna give away? You probably know. Pumpkin Nutriberries, pumpkin spice Nutriberries. Um, that is gonna go out to Heather Phillips, pumpkin spice Nutriberries plus another Lafeber product of your bird's choosing. So congratulations. It's like an early treat with no tricks. Anyways, and then so we had to reschedule it from last week, but this next Friday, October 3rd, we're going to be on with Pamela Clark, and she's going to do her webinar on screaming. So join us then. I'm sure that'll be a hot topic for some. So there you go, guys. We've got so we'll see you back October 31st. Dr. Tully, thank you again.
Halloween, yes, indeed.
It's easy date to remember.
It is. It's a Friday, isn't it?
It is.
Halloween's on a Friday.
It is. Yeah.
Oh, check that out. That was like as a kid, it didn't get any better than that, right?
Oh, it was the best.
Friday,
You can
Halloween.
sleep in. Yeah.
You know, so yeah. Well, we're gonna be, and then we're gonna talk about the yellow cockatiel syndrome if I find out any more information. So thank
There
you.
we go. Yeah.
For that.
Syndrome.
And Laura, thank you, and all of our webinar attendees and the wonderful questions. It's always a pleasure, and I look forward to next time.
All right. All right. Until then, guys, everyone stay safe. Have a wonderful weekend. All the best to you and your flock. Bye.
Yes. Bye-bye.